Good afternoon, Spine and Sport resident mentors. This week we covered basic science of bone and cartilage. Additionally, we covered bone and cartilage considers for rehabilitation. In general, what the residents learned this week were all about articular cartilage, the fibrocartilage makeup of the articular cartilage. We spoke extensively on the application of how that applies to clinical practice, especially noting the avascularity and aneural components of articular cartilage. They had a very good insight on that. Next week they have a special project that they're going to be taking a look at how diabetes affects healing and how diabetes affects articular cartilage and the healing process. We also spoke extensively about articular cartilage, how it responds under compressive loading, as well as lubrication of the articular cartilage. We spoke some about repair of the articular cartilage and a little bit about bone morphology, but they did cover that in the independent study course. We spoke about age-related changes to bone. We had extensive conversation, really interesting and fun conversation about the communication process that occurs and how to get your patient to respond and ensure that they actually understand the diagnosis that you have given them. In bone and cartilage considerations for rehabilitation, we spoke about the summary of recommendations for strength training in children and adults. We also spoke about risk factors for fascial plate injuries and what are some of the mechanics that a therapist would be looking for during the subjective history. We spoke about the rehabilitation of post-fracture management. We spoke extensively about osteochondral lesions and how the rehabilitation and application and dosage of exercise affects osteochondral lesions and what the nociceptive input to both the subacromial bursa and the fat pad are. We spoke about osteoporosis as far as the predisposing factors to osteoporosis and what to be looking for, especially in young women. And that covers the majority of what we did this week. Next week, we're going to be covering ligaments and tendons, basic sciences and implications for rehabilitation, as well as ligament and tendon injuries and the healing of those. The following week after that, we're going to be covering clinical decision making, and the week after that, we're going to be covering shoulder special testing. If you have any questions, please never hesitate to give me a call, and I look forward to speaking to you soon. Thank you.